Hello everyone and welcome. Today we're going to be discussing wound treatments, a review of dressing categories. Acrylics. Have an acrylic polymer pad that's topped with breathable, waterproof film that has a moisture vapor transmission rate to support evaporation. They're indicated for wounds with low levels of exudate, autolytic debridement facilitation, and protection of intact newly epithelialized skin. It has an extended wear time of 14 to 21 days, and you're able to monitor the wound without changing the dressing. These dressings are contraindicated in wounds with moderate and high levels of exudate, venous leg ulcers, and infection. And it's important to note that you do not cut the acrylic pad. An example of an acrylic dressing is Tegaderm absorbent. Topical antimicrobials contain an agent that assists with reducing bacterial load. They're used when superficial wound infection is suspected. They should only be used for a short period of time, and if infection persists, systemic antibiotics should be considered. They can be used in conjunction with systemic antibiotics. The dressing must come in contact with the wound bed in order for it to be effective. And you want to try to use topical antimicrobial dressings for 2 weeks to determine their effectiveness. However, if the wound is rapidly deteriorating or infection is spreading, you want to ensure you're consulting the physician or the wound care specialist immediately. So we're going to look at some various antimicrobials that we have currently in the home. The first being Inidine. It contains povidone iodine, which is effective against microbes. It minimizes adherence to the wound bed, thus reducing damage with dressing changes. As you can see in the bottom right-hand corner, it does have a mesh-like appearance to it, and it is orange in color from the iodine. So the dressing will change color from orange to white to help prevent unnecessary dressing changes. As you can see across the spectrum of about 6 days, as the iodine is released, the dressing will change from orange to white. This does depend on the level of exudate from the wound. It may turn white quicker, thus requiring a new dressing change. If the dressing is changing white very quickly within about a day or two, you want to consider a different iodine treatment modality. Now, iodine-based dressings should be used with caution in those with renal disorders, thyroid disorders, deep ulcers, burns, or large injuries. Hydrophera Blue is a foam containing methylene blue and gentian violet that provides broad-spectrum antimicrobial activity. As you can see, it is blue in color and does come in various forms. It does come in a rope for packing of tunnels, and it does come in a big foam sheet. The foam is hard and it requires moistening prior to application, unless you're using the ready-to-use version. And similar to Inidine, Hydrophera Blue will turn white as the antimicrobial properties are absorbed. Silver dressings have bactericidal properties that destroys membranes and cell wall proteins, so it contributes to cell apoptosis or cell death. They should not be used for a prolonged period of time as there is potential for tissue toxicity and bacterial resistance. You want to discontinue a silver dressing once the superficial infection is no longer a concern. So there are many different classes of dressings that come in a silver form, and it's usually denoted by AG+ on the package. So some examples of products we have in the home, we do have Optifoam Gentle AG, a foam dressing. We have Maxorb AG, which is a calcium alginate. And we also have Opticell AG, which is a gelling fiber. Honey is another topical antimicrobial we have available. So the Manuka, Jellybush, and pasture honeys are capable of stimulating immune response. It has the capability to debride wounds, so honey will actually digest fibrin, which allows slough to attach to the wound base. Now, this is only to be used in consult with the wound care specialist, but the example that we have in the home is TheraHoney Gel. It does come in a liquid tube or it does come in sheets. Topical antiseptics. They destroy or inhibit the growth and development of microorganisms in or on living tissue. They are used mainly in non-healable pressure injuries where the goal is to decrease bacteria. You want to make sure you consider an antimicrobial agent first prior to the use of an antiseptic. And the decision to use antiseptics are based on physician and/or wound care specialist recommendations. Antiseptics target not only bacteria, but viruses, fungi, and protozoa. And they should only be used for a short time. An example of a topical antiseptic used in the home is povidone iodine. Again, caution must be exercised when using iodine in residents with thyroid disorders, as iodine is directly involved in the production of thyroid hormones. Calcium alginates are derived from seaweed, and they form a soft gel when mixed with wound fluid, which helps to maintain a moist wound environment. They can absorb 30 times the dressing's weight in fluid, and they can be flushed with saline for easy removal. So calcium alginates are indicated for filling dead space and for heavily exudating or bleeding wounds. Contraindications for this dressing class are for dry wounds, narrow or deep sinuses, third-degree burns, and in a situation of heavy or uncontrollable bleeding. The calcium alginates we have in the home is called Maxorb, and it comes in various forms. It will come in sheets or rope. Charcoal dressings. So they contain charcoal, which absorbs odor, and it's used in conjunction with other dressing therapies. It does have absorptive capacity. However, if there's a copious amount of exudate, it will compromise the odor fighting capacity. So in cases of excess exudate, you can use other absorptive agents. Now just keep in mind that charcoal dressings will mask odor, but will not treat the underlying cause. So of course the underlying cause should be investigated. The charcoal dressing we use in the home is Carbonette, and as you can see, there is a shiny netted side that is white in appearance, and when you're applying the dressing, you want to make sure that the shiny netted side is down. Next, we have films and membranes. So they're thin, transparent polyurethane sheets, and they do not have the ability to absorb. So they're used on dry to minimal moist wounds only. And it's mainly used as a secondary dressing or a cover dressing. So it's important to note that these types of dressings should not be used on any wound that is presenting with signs or symptoms of infection. They're contraindicated in the elderly, as the adhesive property can contribute to the reopening of the wound with fragile tissue, and it's also contraindicated for moderately and highly exudating wounds, deep cavities, and full thickness burns. So the example of the product that we have in the home is SureFilm from Medline, and it comes in two different widths. We have 10 centimeters and 5 centimeters. Foams remove exudate and has increased capacity for fluid absorption. So it allows water vapor and gases to penetrate, causing wicking, which is pulling fluids away from the wound bed. And it can either wick horizontally or vertically. These can remain in place for up to 7 days, and they should be changed as needed when approximately 70% of the pad presents with exudate. Most foams can be cut to size, so you want to make sure that you're checking the packaging. So foams can also be used to fill dead space. They're indicated for moderately draining wounds. You want to use it with caution in residents with diabetes, as it does not reduce plantar pressure, and excessive drainage may lead to maceration. It comes with or without border. So Optifoam without border will require a secondary dressing to secure it in place. And so as you can see here, what we have for foams in the home is the Optifoam dressing line. So we have the plain foams that could be used for packing, but we also have the bordered ones that have the built-in secondary dressing capacity to them. And they also come in different shapes and sizes. There are ones that are specifically designed to be placed on sacrums, etc. Gauzes are made from fibers of cotton, rayon, or polyester, and they come in various shapes and sizes. So gauze is indicated for wounds with low to high levels of exudate, used for filling dead space, which isn't a common practice anymore. You can use it to deliver pastes, ointments, and gels, use it to cleanse the peri-wound tissue, and use it for absorbing wound cleansers. So it functions as a primary or secondary dressing. Often we're just using gauzes for cleaning or as a secondary dressing. So an example in the home that we have of a gauze secondary dressing would be the bordered gauze line. Gelling fibers are absorbent fibers that transform into a clear and comfortable solid gel and provides optimal contact with the wound. They're indicated for moderately to highly exudating wounds, and they act as a wound filler. It functions as a primary dressing, therefore it will require a secondary cover dressing. They're contraindicated for dry wounds and use in narrow, deep sinuses. So the example of the gelling fiber that we have in the home is our OptiCell line. It does come in sheets and ribbons, but also it comes in a reinforced ribbon for packing deeper tunnels. Hydrocolloids have an active surface treated with a gel-forming substance when it comes in contact with wound exudate. These dressings are impermeable to bacteria and fluid. They only adhere to intact skin, so it does not disturb healing at the wound base. They are indicated for wounds with low levels of exudate, and they can remain in place for up to 7 days. Now, it's important to note that this dressing class can develop an odor when you're removing the dressing, so that's normal and is not always indicative of infection, so make sure you're completing a thorough assessment of the wound. Hydrocolloids are contraindicated for deep cavities, infected wounds, wounds with moderate to high levels of exudate, and wounds from arterial insufficiency. So considerations for this dressing class, you do want to observe for peri-wound skin maceration, as the absorptive capacity of the dressing is minimal. You do not want to use it on wounds that are infected. You can actually cut this dressing to fit any wound shape or size. They can be used as primary or secondary dressings. When removing, you want to peel back just the edge of the dressing and roll the dressing off the wound. You do not want to pull. And a trick for application: prior to putting the dressing on, if you take your hands and rub them together, creating that friction, getting your hands nice and warm, place the dressing in between, remove the film on the back, put it in place on the resident, and again, repeat the same process by warming up your hands, rubbing them together, getting that friction, placing your warm hands over top and leaving them there for a minute or two. This will help increase adherence of the dressing to the skin. And the product that we have in the home that is a hydrocolloid is called Exuderm. They do come in various shapes and sizes. Hydrogels. So hydrogel has a high water content, so it's indicated for wounds with minimal or no exudate to add moisture and to facilitate autolytic debridement. When applying hydrogel, it has to be applied at a minimum thickness of 5 millimeters, and you do not mix hydrogel with iodine paste compounds. So peri-wound skin may need protection from maceration, so make sure you're using your skin prep. Hydrogel is contraindicated for moderately to highly exudating wounds, infected wounds, and wounds from arterial insufficiency. So the type of hydrogel that we have in the home is a Medline product called Skintegrity. Non-adherent synthetics. They're porous sheet dressings used to prevent adherence to the wound bed and allows the transfer of exudate to the secondary dressing. They may be composed of silicone, paraffin, or petroleum. It is important to note that if these products are double layered, they can become occlusive. They also may contribute to moisture, therefore should not be used on wounds where the goal is to dry. They have no absorptive qualities. They're indicated for painful wounds, wounds with friable granulation tissue, and prevention of adherence of secondary dressings. An example of a non-adherent synthetic we have in the home is Adaptic. Pain control dressings. So these are foam dressings that continuously release ibuprofen, and they're indicated for the treatment of painful exudating wounds. They should be applied directly to the wound for effective absorption. Now, it's important to note that these dressings do not impact systemic levels of ibuprofen, and it does not pose the risk for gastrointestinal complications. And an example of a pain control dressing is Biotin IBU. This dressing class would be prescribed by the wound care specialist or the physician. Absorbents. They're designed to treat highly exudating wounds and protect them from exposure to the environment. They are capable of retaining large amounts of exudates and preventing bacteria from entering the wound. Do not cut these dressings as it will lose the ability to absorb. It's important to note that you can cut the back of the dressing to double layer, thus increasing the absorption capacity as exudate will absorb through to the second layer. But you cannot cut these dressings to fit the size of the wound bed. And it is used as a secondary dressing. So an example of an absorbent that we have in the home is Optiloc, or we also have Mesorb, as it is available in a larger size.